See that? It looks big, but remember it's framing the outside of the cassette. So, and we labeled it for you. So this goes in here to hold the cassette, and then this goes in here. So what happens when you don't use this? Yeah, because these weren't designed for smaller cassettes. You know, these were designed for the DR unit. So they're like, you want to do what? Why would you want to do that when you have the DR? Because I still want to teach students how to use cassettes. Some hospitals may not have DR units, they may only have CR cassettes. So now that I'm using the butt key, what do I need to do? Well, besides that, before even I go over there, what do I have to do? Detent. Detent. So make sure I'm detented side to side, first thing, right? And then detented top to bottom, 40 inches. Okay, so with her size, what do you think we would do with, usually we keep a caliper here. What would we do with the tube angle on her knee? Likely, according to the book. Yeah, because she's probably, I'm going to guess, about 15 centimeters. Do you want me to keep the secret? Okay, so I'm going to put the caliper right here at the ACES. She's 14 and a half. Pretty close. I've never ever done any angled coddling. So I'd either say keep it perpendicular or angle cephalic. Okay, so can you scoot over towards me just a little bit? All right, so for the knee, we're going to do the AP first. So again, you just want to flex the foot up. And the reason I'm flexing the foot is it's easier to rotate the leg when the foot's flexed up. Okay, so you notice that when she's normally laying in a natural position, the leg tends to turn out, so we want it straight up and down. Here is the patellar apex right here. You can see her patella right here. Okay, so that's where I'm going to center. It's just below the apex. Make sure this is centered. Okay, so the butt key and the tube are aligned. Leave that alone. Anything else you need to do, just do it with the table. Make sure this is no bigger than 12 inches top to bottom. And then for her, I could collimate 6 inches side to side. So typically for the knee, you're going to use the full 12 inches top to bottom to get as much of the femur and the tib fib as you can. But obviously I don't have to leave it 10 inches this way. Okay? If you are going to angle 5 degrees, then you have to compensate for what? You angle the tube, then what? Yeah. At the 5 degrees, we don't usually bring the SID down. It's at 10, we usually mess with the SID. But look what happened to my centering. So what I want to warn you about is if you're all set up here, then all of a sudden the last minute, oh shoot, I should have angled, right? I'm doing this as charming to me, I need to angle. Wah, wah. Look what happened. Now it's a repeat. So you're almost better off losing the points for angling and angling at the last minute and forgetting to center to your cassette, because that would definitely be a repeat. See where your image is going to end up? It's going to end up right here. So always get your tube and your cassette aligned and then leave it alone. And you can mess with the other stuff as far as centering afterwards. Okay, easy peasy, right? And what's best seen? What is the AP? Stop looking at your series notes. Tell me from your head. I'm going to stop allowing series notes in here. Yeah, well, an open joint space and then the radial. See, I know I was going to do that. The tibial head slightly enclosed over the femur. Okay? All right, now